tonight's second installment of our Elevating What's at Stake in 2024 webinar series, this time on empowering Black women's health and wellness, something we all know is important. On behalf of Eastern Area Director Lisa Loury Lomas and the entire Eastern Area leadership team and the members of the LPA committee, I thank you for joining us tonight. Women's health equity is one of the 6 national priorities of the Links Incorporated. And so tonight, we will be addressing a full range of women's health issues: reproductive health, physical health, and mental health. And we have an amazing panel to help guide us through it and share their insights, led by our moderator, area director, but also Dr. Lisa Loury Lomas. So listen and take it all in, but get your questions ready because we will have a brief opportunity for question and answer. You can use the Q&A feature right in your Zoom. As a moment of personal privilege before we begin, I want to thank Takesha Everett, a member of our committee and the Prince George's County chapter of the Links Incorporated, who helped to plan this panel, but she is unable to join us tonight due to work obligations. Still, we couldn't have done it without her and Eastern Area Program Coordinator, and she's going to kill me for doing it, Siobhan Kershaw. And so I want to thank them both for their efforts. And now I will turn things over. Actually, I'm going to do it because there's some technical difficulties here. I'm going to have the privilege of introducing our area director and our moderator tonight. Lisa, your member, area director, Lisa, why don't you join me on here? All right, I'm going to embarrass you by introducing you. We're really, you can talk on many things, but this particular topic is particularly exciting because you come from the healthcare community. So in addition to, Dr. Lomas being Eastern Area Director, she has worked in the field of psychology for over 30 years, and she's only 20. So, imagine that. She is recognized, as an expert in human relations and development, and she is affectionately referred to as Dr. Lisa by her clients. She has a bachelor's degree in psychology and a master's in clinical psychology, focusing on father absence and the effect on self-esteem. And she has a PhD in general psychology with a particular emphasis on applied social psychology and the impact of imposter phenomenon and self-esteem on development, motivation, and success. And we know that is something that Black women deal with. And all women actually, and all people. So I'm so glad that she's here to talk about that. We are so glad to have her here. She is the joyful mother of Jeremy and William Lomas. And I think it's important we are well-rounded women on this call. I am so thrilled to have her on with us tonight. And if I missed anything, I know she's going to fill it in. Thank you so much. Moderator, Area Director Lisa Loury Lomas, I will let you take it away. Have a great evening, everyone, and I'll see you at Q&A.
Thank you so much, Joy. Thank you, thank you, thank you. Thank you to you and your committee. Thank you to your co-chair, Shauna. And I'd like to also thank Takesha Everett for her assistance, and of course, Siobhan Kershaw, and the Eastern Area Legislative and Public Affairs Committee, Eastern Area Operations Committee, and the Eastern Area Comms Tech Committee for your hard work. We could not get any of this done without each and every one of you. This is a team effort and a labor of love. Welcome to all who have joined us this evening for tonight's crucial discussion. Elevating What's at Stake in 2024, Empowering Black Women's Health and Wellness. April is Minority Health Month, and so we have focused on health throughout this entire month. Today, in particular, is the last day of Black Maternal Health Week, when we focus on strategies to improve pregnancy, prenatal care, postpartum health for Black women who have some of the widest maternal health disparities in the nation, but also for all women, as what we do for Black women benefits all women. I am particularly excited about today's program because it centers on a topic that ignites a deep personal and professional passion within me, as Joy mentioned. Black women's health and mental wellness. As a clinician in the field of psychology for my entire career, it's been my life's work and passion to support, educate, inspire, and empower women in every aspect of their lives, but particularly when it comes to their health. And we all know without good mental health, there is no such thing as good physical health. So we have to balance it all out. Tonight, we elevate the health and wellness topics that are at stake in this crucial 2024 election year, when our nation will select its elected leaders at the local, state, and federal levels. And we will leave you empowered to fight for the policies and policymakers that will improve your mental and physical health and the health of all of our communities. I'm thrilled because we have the privilege of being joined by 4 highly qualified, amazing, true champions for health equity and esteemed leaders in their respective fields. I will start with the 16th National President of the Links Incorporated, Dr. Glenda Newell-Harris, Regional Medical Director of Yes Care, and a member of the Alameda Contra Costa, California chapter of the Links Incorporated. Thank you for joining us, Dr. Newell-Harris. We also have Dr. Yolanda Lawson, President of the National Medical Association and founder of Madewell OBGYN, and member of Dallas, Texas chapter of the Links Incorporated. Welcome, Dr. Lawson. Dr. Regina Davis Moss, President and CEO in Our Own Voice, National Black Women's Reproductive Justice Agenda, and member of Capital City chapter in the Washington, D.C. area of the Links Incorporated. Dr. Davis Moss, thank you for joining us. And last but definitely not least, Dr. Cicely Horsham-Brathwaite, CEO and founder, Brathwaite Consulting, PLLC, and licensed psychologist, professional coach, and member of the Long Island, New York chapter of the Links Incorporated. Yes, all of these dynamic women are members of the Links Incorporated. Thank you, ladies, for joining me. Very proud to be able to share the screen with you this evening. So we're going to jump in. As we all know, core to any democracy is the health of its women and children. The United States has some of the worst health outcomes for women, particularly for Black women. In fact, the United States ranks among the highest nations in spending on healthcare, but among the lowest in healthcare outcomes. A strong democracy has a public health and healthcare system that works for all of its citizens, so healthcare is at stake in 2024. My first question goes to you, Dr. Newell-Harris. Tell us about your practice so we know your perspective, but also what would you identify as the most glaring health disparity for Black women in the United States, and what are the root causes of those disparities?
Well, thank you so much, Dr. Lisa, for having me. It's an honor to be here this evening. I currently work as a regional medical director for the Yes Care Corporation, which is a company that provides healthcare to prisons and jails. And so I am certainly right there in the trenches in terms of dealing with healthcare disparities. Yeah. But when we want to talk about healthcare and women's healthcare in the areas that I feel are areas of focus, I think we first have to start with mental health, as you've pointed out. I mean, that is the biggest area. If your mental health is not right, then it's really even difficult to get to your physical health. The other areas of significant concern, I feel, are the health that we provide to our Black mothers. Black Maternal Health, as you pointed out, today is the 7th day of the week of Black Maternal Health, and that is an area of incredible concern and disparity. And I see that in my work as well. The other areas of health that are significant are just the chronic conditions that we as Black women have. We have the highest rates of obesity, cardiovascular disease, many of the cancers, and mental health as well. And so all of those areas We've got disparity issues. We have distrust issues. We have lack of provider availability issues. We're busy taking care of everybody else but ourselves. And so with that, coupled with some of the systemic systems, that a brokenness of our healthcare system, it's just sort of a perfect storm for it to be a problem for Black women to be able to get quality healthcare.
Thank you very much, Dr. Lawson. I see you nodding your head.
Yes, to piggyback onto my colleague, and thank you for having me. This is such an honor to me. I'm here in Washington, and we just came off of our policy meeting, the National Medical Association. We discussed so much of this issue, but, recently I've been doing a lot of work around women's health. I am an OBGYN, of course. And so one of my pillars this year during my presidency is the Black Women's Health Agenda. And there are 3 focus areas I have, of course, being an OB-GYN, maternal and reproductive health. The second is HIV, and the third is cardiovascular disease. And so cardiovascular disease, we have to just call that out. When you look at, I talk about this often, 60% of women, Black women, over the age of 20 have some form of cardiovascular disease. I talk about this as I go across the country. Black women are the most hypertensive beings on the planet. And so when you think about
over the age of 20, I just want to pause for a minute.
60% of women, Black women over the age of 20 have some form of cardiovascular disease. That's striking.
It's striking. And I want to make sure that our audience did not miss this. We're talking, you're not allowed to buy alcohol. You are 20. You are still in college.
Right. And here we are.
That is powerful.
It's very powerful. And so that is why that's one of those initiatives I've worked on. Several focus areas, of course, but for me during this presidential term, those 3 are 3 highlights. But of course, the NMA is composed of 26 medical specialties, right? So we have an OB-GYN section, we have an oncology section. So of course, our concerns, cancer disparities. Yes. I've just talked to you, cardiovascular disease disparities.
Wow.
You look at Black women, we have fibroids and these other reproductive healthcare matters. And so all of these things are to heart. And in one of my personal passions that I work on is around HIV prevention in Black women. And so when you look at in the United States, 1 in 4 diagnoses of HIV are in women. And people failed because there's still a lot of stigma, and people think of another picture when they think of HIV. And then when you look at the HIV cases in women, about 54% are Black women. So we are disproportionately impacted. Yeah. So all of these things are concerns and things that we work on organizationally through specialists throughout the country to advocate for, thinking about refining policies, and then just making sure people have access. Access to screening and preventive testing is so important.
You mentioned stigma. I mean, stigma stops us from growth in so many areas. Yes. Dr. Horsham-Brathwaite, historical and contemporary racism lives in the genes and bones and the psyche of the body and mind of Black women. Yet we know that for many Black women, it is difficult to seek mental health support. We still have a stigma attached to it, both because of historical taboo nature associated and to the access to care, as Dr. Lawson was talking about, can also be challenging these days. How can we address mental health stigma and ensure greater access to care?
First, as others have said, I'm really delighted to be here this evening with this esteemed panel and grateful for the invitation. As I think about your question, I want to take it back a little bit to say that I think part of what impacts the stigma around mental health is that as people of African descent, we have been taught to be distant from our traditional ways of healing and knowing what our body, mind, and spirit need. And so being distant from that, being taught that our traditional practices are wrong, are not scientific, helps to keep us from looking at ways in which we can actively support our health and well-being. And when you add to that, that my discipline, psychology, has not done a great public relations job of getting the word out to Black communities about the care that we offer and the benefits of that care. And also, we have a legacy of not having been respectful of Black communities that enhances the sense of stigma, because it is not only the historical impact of what our disciplines may have enacted upon Black people, but it is the current impact of going places where we are labeled or not explained to about the things that we are struggling with. And that when we go for care, either our desires for support are minimized or maximized in a way that pathology is the focus. And so how do we do that? One, by having forums like this to reduce the stigma around care seeking. I would also say listen to the young people in our lives, because they have peeled away some of those layers of mental health stigma and often are asking for support. And for those of us who come from places around this country or like me, have family who immigrated to this country, sometimes we're also told, you think these are problems? Imagine what the problems might be. So I think it is a combination of presenting ourselves with opportunities to learn about how mental health care can be helpful, and then aligning with organizations that are focused on providing culturally competent care, like the Association of Black Psychologists, like the National Association of Black Social Workers, who aim at bringing both cultural understanding as well as physical and mental health understanding into the work.
Thank you. Thank you. I agree with you. I have two sons, as was mentioned earlier. They're young men now. They're not children. And when you talk about this next generation changing the conversation and the dialogue and really just being open and transparent, many of them, when it comes to the topic, when it comes to their struggles. And as a generation, sometimes they are dismissed, they're shut down, or they're told that, to your point, you think this is tough. You should have been through what I've been through, And so, as a generation, how can we support? And I'm going to go back to you, Dr. Newell-Harris, and then I'm going to circle back to you, Dr. Davis Moss, because I have a question I'd like to ask you. But when it comes to advocating for yourself and supporting your children, what are some recommendations that you would have around that?
Sure. I would love to also just sort of add to that previous question regarding the demystification, because this is part of the advocacy, I believe, as well. And that is somehow or other in this process of growing up, many of us were trained that somehow to reveal our feelings was a weakness. And we've got to get beyond that. There is nothing weak about sharing your feelings. I mean, for some reason, we don't equate our psychologist the same way we do our cardiologist. But really, if you haven't already seen your psychologist, then you won't be really ready for your cardiologist.
Right.
And so those doctors, psychiatrists and the psychologists need to be seen and equated in the exact same way. There should be no shame. In fact, believe it or not, I'm sure, Dr. Lisa, you won't tell us, but your office is probably full of doctors and lawyers. It should be. But that's another part of it. But part of this is advocating also. If you see a loved one that is stressed or having anxious feelings or concerns, as a friend, as a sister, that's an opportunity for you to just step right in and, help to navigate that person to the proper person. You may not be the one that wants to be able to provide the coaching and the counseling, but acknowledging that there is a concern and then identifying that you want to get professional help. And there's also nothing wrong with being very specific about your care. If you feel that a Black male is a better a therapist for you, then seek that person out. If you think a Black female is the more appropriate person that you would connect with, it's your health plan. You're paying for it, you and your employer.
Yeah.
And so you need to seek out the kind of provider that you feel that you will resonate with. So that's, that is a critical part of getting well. In particular, I think with mental health, you've got to be able to connect. You've got to be able to resonate with that person. You've got to feel like they are listening and hearing you and really responding in order for the encounter to be meaningful for you, for that moment, and for hopefully the duration of your time with that provider.
And I just like to piggyback on and say, shop around. If you've been with somebody and it's not a good fit, that does not mean that therapy does not work. It means you just haven't found the right person, and keep looking until you find one that's a really good fit. It's so important. And we could talk about, strength and what's considered weakness and strength. I've not had a time in my life where someone hasn't told me to be strong. And really what they were saying is don't feel. Don't feel, don't talk about it, don't, but I could talk about this all day long. I'm going to shift our conversation a little bit. Dr. Davis Moss, Roe versus Wade was overturned by the Supreme Court's Dobbs versus Jackson Women's Health Organization in 2022. Effectively, this sparked a cascade of legislative and executive actions in states that have restricted access to abortion and access to other reproductive health services for women and girls. Reproductive freedom and justice is definitely what's at stake in 2024. Can you first start by defining reproductive justice for us and share how crucial this election is for Black women?
Absolutely. That's, first of all, thanks for letting me join you. This is such a timely and important conversation. So I am the president and CEO in our Voice National Black Women's Reproductive Justice Agenda. And I want to start by making this distinction. So when we hear these words that we're hearing, things like reproductive rights, reproductive freedom, reproductive liberty, they are not synonymous. Reproductive rights focuses on the constitutionality and legal right to have. Reproductive health focuses on service delivery. So these things like Glenda Newell, Dr. Harris, and others on this webinar I've been talking about today. And reproductive justice is actually a framework that we use that affirms four things. First, it's your right to have a child, your right to not have a child, your right to raise that child in a safe and sustainable environment, and the right to sexual expression. And we believe that these are basic human rights, that just by virtue of being born, that we're entitled to these things. And then when we affirm these rights, that we can go on to do all those things that we talked about. So being able to thrive, having optimal mental, physical health, having economic security. And what these 12 women who created this framework 30 years ago saying is that, we can't just think about what we're going to do when the person gets pregnant. There's all these pre-existing conditions that happen before someone gets pregnant that have just as much of an impact on that decision they're going to make, whether they continue with that unintended pregnancy goes on to become a baby. And so what they were saying is things like living wage are important. Things like, can I finish my education? Mm-hmm. Can I continue to have this job? Do I have a place that I can raise this child? Do I have to worry about will they have safe places to play? Where I'll be able to afford nutritious food. So all of these things are what we call typically the social determinants of health, but they're also very much social justice issues. And so those Black women said, we will splice these two very important issues, our reproductive rights, because to be sure, we're not pushing back on the notion that we should absolutely have the right, and that's a personal decision, but we also want to center these social justice issues. And that's how they came up with the term reproductive justice. And I would say it absolutely, this framework, which has been around for 30 years, absolutely meets this moment. Black women often are ones that have to come before and raise these concerns. We've been raising these concerns for 30 years. And now here we are 2 years later with Dobbs. And guess what? We're the most disproportionately impacted. So we're seeing what happens when we have abortion restrictions. My organization produces a poll, and overwhelmingly we are afraid. We are disproportionately in the states where these restrictions are being enacted. So we're hearing Black women say, not only am I afraid to get pregnant, I'm afraid to live in these states. I'm afraid to, my pregnancy is not viable and I have to go get treated for a miscarriage, I'm afraid to go to the emergency because we see the thing like Brittany Watts. So all of these issues are very prevalent. And I'm going to end by saying the way that we deal with this is that we vote. Black women are the largest voting bloc in the American electorate. We are by far the people that are some of the most decisive in these elections. And so we want to see change, but we have to exercise that power.
You know, there's been a lot of discussion about voting and people not voting, especially in the younger generation. You know, what do you think we can do to help support and encourage and really help people understand the importance of voting, no matter who you vote for?
We pulled on that too. And I will be honest, younger voters are, there's a little bit of malaise, and rightfully so, because they have other concerns. They're concerned about things like the economy, student loans. But at the same time, a poll also said 76% of them said that I understand the power of my vote. I know that when I vote, it can change the trajectory of things. So we're leaning into that because what that says in any type of situation, you are a trained professional. You know that when people are not feeling heard, the first thing we need to do is deal with that so that we can, have that truth and reconciliation that can be heard, and then we can move forward. But it's too important to not vote. And I always like to say, if it wasn't so important, why would they be working so hard to take it away? So that I will say on the whole that we know younger voters want to be heard. They're concerned about things like what's happening in Israel. But at the same time, they have also overwhelmingly said that my ancestors fought and died for me to have this right. And they do intend to vote.
That's heartwarming. I'll tell you, that gives me hope because that is not, of course, what I'm hearing a lot of in the media and even as I speak to young people directly. Dr. Newell-Harris, you're nodding your head.
Yeah, regrettably, I'm hearing the same thing. Here in California, they don't have the feeling that, their ancestors died. They don't. I was just sitting here thinking, how can we bring it to the forefront? I mean, I hate to look at our entertainers, but this is a time where really we've got to be able to meet the young people where they are, because ultimately the goal is getting them to vote. I mean, do we need Stephen Curry to do some commercials? That it's important to vote? Do we need Beyonce to do a song about voting? I mean, we've got to be able to do some things that are going to make it relevant, because to your point, it's all about student loans and housing. And are they going to be able to get their needs met? And they often don't connect that with the voting. And everything hasn't really kind of worked out like we thought it was going to, we were told. So we have to stay in the trenches, I think, and continue to press forward because, if you can tap 4 or 5 young people, then maybe they can tap 4 or 5 more. But it may be that it's the entertainment industry that's going to have to help us. But we have a lot to do here in the state of California. What I'm hearing does not sound good.
Yeah, that's scary.
We need everybody in this fight now. So it's a relational engagement. Make your voting plan, bring others to the poll, find out what their plans are going to be, because we all need to turn out strong.
Yeah, absolutely. Absolutely. Dr. Horsham-Brathwaite, are there mental health consequences for gender-based policy attacks on Black women? It is definitely a form of trauma that Black women are facing. What are some ways we should center our well-being and mental health in face of such vitriol?
That's an excellent question. I do want to add to the last question before I respond to that. I agree with what I've heard. And I also would add that I think that some of what younger folks are bringing to the conversation is a challenge to some of the things that we have coped with and seen as a necessary part of what it means to live in this country, in this world. And where I do see excitement is around immersing themselves locally, and participating at the local level. And I think it is a way to also encourage voting. But I also see them asking questions publicly that disrupt the status quo and allow us to imagine change in a way that we might not have spoken about in the past. And I think that also sort of ties into your question.
But before you can you elaborate on that? What are you hearing from the younger generation?
Yeah. Well, I'm hearing things can be better and different. I love Adrienne Maree Brown, who is an organizer and leader who talks about all organizing is science fiction, right? It's envisioning a future that doesn't currently exist. And so I think what I'm hearing in that future is things that I might have experienced or that our generation might have been taught to talk about privately. Mm-hmm. I'm hearing from young people talking about publicly. I also get to, in some of the work that I do, get to be a fly on the wall, seeing organizations by and for young people who are working to fight for people's right to be enfranchised, fight for their right to make sure that they have the information about registering to vote, and then asking of their elected officials questions that are hard questions, even if they fall on the same political lines, to be able to say, what about this? What about the environment? So I think that what they are doing is shifting the conversation and really requiring of those who seek office to take a position, answer questions, even when we might agree broadly about some of your policies. I think that's what I see. And that is about environment, about what happens in school districts, what is allowed and what is not allowed. And so I think that's some of what I see. And I also think those young folks are tired. They have not had the experience of relative peace in ways that we might have had periods of that. Sure. So I think that's some of what I see. I see both a sense of disenfranchisement and a sense of pushing the boundaries. In terms of your question around what are some of the mental health impacts of having to navigate a world where you clearly see the laws are designed not to support your rights, not to support your right to reproductive justice, right? And so what I see is there's sort of a shift. For many of us, we encountered racism, sexism in the workplace, and we were able to have tunnel vision towards our goal for our education, our goal for our career, our goal for our families. And then all of a sudden, that relative peace has been impacted by the Dobbs decision, by rolling back of the rights of voters. And we can no longer have that tunnel vision. And quite frankly, the folks that I support, both in a therapeutic sense and then in an executive coaching sense, are feeling that pressure, to lead effectively while experiencing their own symptoms of anxiety, depression, overwhelm, burnout, and then having to navigate that within their families and their communities. And some of the ways that folks do that is to get support from a clinician, get support from a friend, a family member, create circles of mutual aid where you can speak about, as Dr. Newell-Harris spoke about, being able to say, I feel sad today. I feel overwhelmed today. And one of the things that we know is that when you even label the emotion that you're experiencing, that takes the thing that you're experiencing out of the old part of our brain to the planning and processing parts of our brain, but it also allows us to experience someone else giving us care and empathy to lower the physiological arousal. We are stressed. We may not be appropriately labeling that stress comes from macrosystemic situations. And I hope conversations like this will help us to understand that we need to, in 2024 and beyond, have a strategy for dealing with the fact that this country and the dynamics politically within this country create an additional layer of stress that has to be mitigated on an ongoing basis because the stress is unrelenting. I think having that conversation and then developing some clear strategies that I hope we get to before we leave here today to be able to manage those stressors is as important as if you got a diagnosis and you had to quickly change your health practices to cope with it. We are in that situation.
Yeah. Wow. That is really powerful. Everyone on this panel is in the trenches. So not only are we seeing or being stressed just by what is happening, but when you're on the front lines, it's an even greater level of stress. If you don't mind sharing some of your own personal strategies, panelists, I would love to hear what some of you are doing. Let me start by saying, I believe in therapy. I am in and out of therapy and will be my entire life. And let me say, if you're seeing a therapist that doesn't have a therapist, find somebody else. You don't want a therapist that doesn't have a therapist. So I believe in it. I encourage it, and I walk my talk. That's one of the things that that I do. And lately, just making a conscious decision to make good habits, because again, in being transparent and opening up this dialogue, I certainly hope I like a good bag of popcorn and a good potato chips and some cookies and a good cocktail. None of those are healthy ways to manage stress, but those are all ways that are in my bag of tricks. So yes, in addition to my therapist, I do have my popcorn, and I love to go out and have a social cocktail with my sisters or my friends. So, what are some other ways that you ladies are handling this, if you don't mind sharing?
I mean, I'll start, with the work that I engage in can be heavy. There are stories all the time where people have had their rights. You wouldn't believe that. You would think that we were back in Jim Crow when I hear some of these stories, being restrained, sort of things. So for me, simple as taking a walk or watching mindless TV. But also, I mean, if there's a situation, if I'm stressed or there's fear or whatever I'm feeling in that moment, I will hold it for them, because sometimes that can propel me. It allows me to confront it. It says, what's operating here? How do I deal with it? And then when I put it down, when it's time for me to move forward. So, I lean into the fact that, we have to acknowledge the stress, and then we have to acknowledge, okay, I'll have some difficulty managing it right now, so maybe I need some help. I mean, that's part of the journey as well.
Thank you. So you have to be present. You have to be in the moment present to be able to acknowledge when that's happening. Thank you. Anybody else want to share?
Well, I'll share. I have to say I'm sort of in transition on how to deal with this. And that's partly because we've got so much crime going on here in Oakland. My walks have stopped right up the street from where I live. And I've walked my neighborhood now for 15, 20 years. We had a woman that was held at gunpoint with a huge dog. And so I have really, that had been a great reliever for me. And I'm fearful. We just got a brand new chief of police. I won't turn this into a political webinar, but these are just the realities of what people, and this is my neighborhood, and I live in a pretty good neighborhood. But I will say that I I have a very close group of girlfriends, and I really trust my sisters. And I make time to engage with them. It's a safe zone, a safe place where you can share and be able to get feedback. And, if you need to cry, you cry, or if you need to share stories and you know that it's a safe place. Many of you also know that I'm a relatively new grandmother. And I schedule time. I have special evenings that are with my grandchildren. And when I am with my grandchildren, everything else gets put to the side. And I feel that it's important for me to do that because I'm really no good or no use to the people that I work for or myself if I can't somehow get refreshed and renewed in some type of way. Like you, Dr. Lisa, I love my popcorn and my cocktail, and I try to just balance it with some vegetables, and grilled fish as much as I can. But do I fall off the wagon? Absolutely, I do. But as they say, in Weight Watchers, you just don't beat yourself up. You can't just, okay, well, I've been bad, so I'm going to continue to be bad. So I try. It's a daily struggle. It's a daily struggle. But, if I ever turn over in the morning and I feel like I don't want to get up, I will go back to the therapist. I have had therapy, and it was wonderful, the therapy that I had some years back. And I have no problem seeking it again when I feel like I'm at that point. I really think in many ways it's something that should be just like brushing your teeth. We probably all would benefit from it on a regular basis. But it's just making time for it and scheduling it. So I have a lot of things that I do to try to keep myself sane. The full-time job trying to make.
Thank you. So I'm making time. So and what I've also heard, you've nurtured relationships over the years that are you can trust and lean into.
Yeah.
That's wonderful. Thank you.
I would add to some of these, sometimes I really have to lean into using my health insurance and my flexible spending so that I go to acupuncture, I have a chiropractor, I have a dietitian. Right now I have a team. And that's something that I felt like I needed to add along with my scheduled exercise with other people, because otherwise I would not do it. And so I think that one of the things I've given myself permission around is to get all levels of support, especially as all of us are in the helping and healing professions. And I actually think every Black woman is in the helping and healing profession. I think that it often requires support.
Thank you. Thank you. And Dr. Lawson, I don't know if you wanted to add to the conversation.
I'm actually not doing a good job with managing it right now, but I have to agree with Dr. Newell-Harris that I tell every woman, you got to have a squad. We all need a squad. I'm usually working. I can't get into a therapist's office because they don't stay open that late, right? But
I work Sundays and evenings. I know I'm not an anomaly.
But that's important to have access. So here we are talking about health, and really it's about access and finding folks that are accessible. But I know my squad, my girlfriends, my sisters, I know that they're always, if I call and it's late, I know that they will pick up if I need them. The other thing I wanted to say, someone just said something else. I love that you all addressed sometimes the coping, the cocktail, the popcorn, the chocolate, what have you, because I think that so many times it is so important for us to call out to community of trying to find those appropriate. So many times people are like, and this is men and women, I'm all right. We all hear it. And so just really trying to amplify and lift up, like this conversation tonight, we normalize that it's okay to have a therapist. It's normalized, and we need more conversations like that in our communities.
Thank you.
For us as Black folks, right? We rely on spirituality. So when you even look at Black women, we're much more likely to go into our spiritual leader than to seek a professional counselor or a psychiatrist, what have you.
Yeah.
And so we acknowledge that too. There is always a place.
Absolutely. And they're not mutually exclusive.
Exactly.
Shout out to our link sister and my friend, Reverend Audrey Akins Williamson. We talk a lot about coming together. These mental health and spirituality coexist. You know, they're partners. And so this has been a really wonderful conversation, ladies. Thank you so much for opening up and being present. I have a few more questions, but I'm going to turn and see, do we have any questions in the Q&A before I get back to my own?
Yes, hi, this is Joy. So one of the questions that we had before we even go to Q&A, we had some pre-questions. And one of them were, what types of screenings folks should get in their 50s and 60s? I think it was specifically women.
Women's health screening. So colon cancer screening, we're going to start there, right? It's challenging. And so, the average age of screening is 50, but for African Americans, we dropped that down to 45 due to the disparities, due to our increased death rate from colon cancer. Of course, for women, breast cancer screening is very important. And so average age is 40 for your baseline mammogram, but it's important to also know that family history and other factors, right? Sometimes that screening may be start at age 35 for some folks. If you had a mother who had breast cancer at an early age, and those other risk factors for breast cancer. The other thing I really love to talk about is for my postmenopausal women, right? So while we know you need a mammogram, while we know you need colon cancer screening, your colonoscopy, and now there's plenty of at-home tests that people can do, bone density screening, right? Black women, typically we have denser bones. We are not really as susceptible to fracturing our hips and such as our Asian and Caucasian counterparts, but it's still important because sometimes we still can see it. My own mother, my grandmother, 98, she died from a hip fracture. My own mother has fractured her hip also. So it's an occurrence because I think it is very important that we age gracefully, that you preserve health, and we all want to be independent. All of you, we are such powerful women, Black women. We want to age gracefully. And so I'm a huge advocate that we preserve the health that we have. And of course, you should see your primary care doctor. We've talked about cardiovascular disease, how rampant it is in the Black community, and definitely for Black women, making sure that cholesterol screening is done. Those blood pressure screenings are done. Did you hear me? Those blood pressure screenings are done because the tragedy for me as a physician is when I see a preventable death or a premature death. That's the tragedy.
Thank you.
Anyone have another question? This one's a policy.
Really quick, yes, Dr. Newell-Harris.
Just your immunizations to that, Dr. Lawson. Your
immunizations. Yes.
We won't go into the details, but we as adults need some immunizations as well. So please be sure to get your immunizations. And I know we're not supposed to say this, but each one of us needs to at least have had one HIV test at some point. And depending upon your lifestyle, she was talking about testing, you want to get that checked too, because to Dr. Lawson's point, preventable diseases. We've got treatment for these diseases now. And so there's no reason why anybody should have challenges with many of these conditions.
That's amazing. So here we have a policy related one. How do we convert judgment and blame to address the needs of low-income women in an uplifting manner?
So I'm going to start this one out because it brings me back. I had a patient walk in who was 400 pounds. And when I started trying to counsel around obesity and weight management, she kind of gave me the hand. And she talked to me about that every time she goes to the doctors, which have been primarily Caucasian doctors, that's all they want to talk about is my weight. And I hear that a lot. And so while while we as Black women, and me being a Black female physician, I know that I'm able to connect in a certain way, right? That's not offensive, that's respectful, but that's informative, because I'm on the basis of education, and you guys will always hear me talk about, I want to prevent premature death, right? And so outside of that, it is very difficult. It can be difficult. It's not easy to tell anyone, right, that you're overweight or you need to lose 100 pounds. But then I also understand that people have to be receptive. And sometimes I get concerned right now around the defensiveness in medicine. We keep hearing about maternal mortality. We hear about these disparities. And the messaging can be so simplified. I'm quite concerned about the emotional and the psychological impact, definitely on young Black women, right? Not even wanting to have children, because all they're hearing over the past 5 years is Black women die in childbirth. So I think we have to be uplifting, we have to be reassuring and encouraging, and even we, have to be careful with the messaging.
Yeah. Thank you.
It looks like Dr. Davis Moss was gonna, okay.
Yeah, I was just gonna add, there's big P and there's little p. There's big policy and little policy. So, I mean, there's things like Dr. Lawson talked about racial concordance, right? Because the research is very clear that if a doctor looks like you, there's a better clinical experience. But we need more doctors. We've seen a decrease in the number of doctors of color going into medical school. So we need policy that's going to facilitate that. So whether that be more funding for those types of things, we can lean into policies around training, not just for doctors, but for the whole entire staff. So when patients come into the doctor's office, they feel that they're receiving respectful care. When we know doctors take an oath, right? So they're going to provide the care that they've sworn to. So now we just need to lean into the things that make that experience not just,
We might have lost her.
Yeah.
They may have, but Dr. Lomas, this goes back to the beginning of the conversation, the importance of voting.
Yes.
This recent proposed legislation around banning DEI in medicine, right?
Yes.
And you think about that implication.
Yes.
They're talking about it from every level.
Yeah.
The NMA was formed in 1895. Right? Because Black doctors didn't have a way. So we had to make it.
Right.
And we have been fighting since 1895. And you really think about that. We've been fighting to be here, to exist, and to take care of our communities since 1895. And here you now, I never thought we would be at this point. I didn't think last year would happen, last June with the SCOTUS decision.
Yeah.
And now this furthering of that.
Yes.
So much of the work I'm doing right now is around that commitment, not only to diversify our healthcare workforce. This past weekend, I convened all of the leaders and presidents of the major Black healthcare organizations. Yes, the president of the Association of Black Psychologists there. The president of the National Black Nurses is there. The president of the National Pharmaceutical there. The president of the National Dental Association was there. The president of, so all of us convened. And we are working in a collective manner, because this is alarming, what is happening now. Because if you talk about racial concordant care, you're right. Multiple studies show we get better care when our doctor looks like us. So we all have to collective, and I ask everyone to join in this, but it goes back to your original point around the importance of the vote.
Yeah.
Madam Moderator, can I offer two more that are in the chat? I'll do them together. And
yes, very quickly.
Okay, really quickly.
Horsham-Brathwaite, did you have something that you wanted to add?
I just wanted to add to that. In addition to voting, Dr. Davis Moss and I have never met, but I know something of the work that her organization and the affiliated organizations do. And that advocacy, that time on the ground to provide care to communities, to provide support, to organize around our rights is work that is heart-centered, time-centered and requires resources. One of the ways that we can do that is to give our time and our talents to those who are working every day for our rights and for our communities.
Thank you. Thank you. Joy.
So, two questions back to back.
Okay.
What suggestions do you have for talking about suicide and mental health with people who still attach a stigma to it? We started to answer that, so maybe a little more on it. And then can you speak to any warning signs and need for immediate care for postpartum depression?
I'd like to respond to that as a start. One of the ways I think that we can normalize and reduce stigma around suicidal thoughts, suicidal ideation, is to recognize that it is actually fairly common for folks to have passive suicidal ideation, thoughts of suicide, without taking action. Humans are very resilient. Once we start to normalize that people sometimes have these thoughts and not make them taboo to even talk about, I think we expand the space where we can listen and hear without judgment. We can change our language from saying so-and-so is thinking about committing suicide to someone is having suicidal thoughts or suicidal ideation, or they died by suicide. We can talk about that when we see examples, and we can say to our family members, you can always talk to me. There is nothing that you can say that will keep me from being there to be supportive. Mm-hmm. And we can also learn about depression and other health-related issues that can bring about thoughts of suicide, so that we can understand what are the signs and symptoms. And for us, often the signs and symptoms don't necessarily look like we can't get out of bed, right, we are not engaging. Sometimes it looks like anger. Sometimes it is being very productive. Sometimes it is loss of memory. Sometimes it is isolation. And so one of the ways is to begin to normalize having these discussions and having them beforehand to talk about. We can talk about life and affirming our lives and the feelings that we have, rather than pretend that sometimes folks don't think, I wish I weren't here.
Thank you. Does anybody else, one more comment as we head into wrapping up? Anyone want to add to that?
I'd like to touch quickly on the postpartum, but I know this is Dr. Lawson's area, so please come on in, Dr. Lawson. I'm a new grandmother, so, but I just want to say that, at the point of the time that the individual is pregnant, I think the family needs to begin to think about the possibilities of postpartum depression. Because the point of the matter is it's real. And so you always think it's not going to happen to you. So I'm thinking about this as a grandmother. When my daughter got pregnant, the first thing I began to start thinking about were all the things that were in my head. Well, what are the things that upset me? Well, I was getting bigger. That whole image issue. You've got to deal with that. And can I get the weight off? You just have, I think for me, unfortunately, I guess I'm a planner. So I began to think ahead. What are the things that could happen? So I think if you start to begin to plan, and planning by having open communication with that pregnant patient in the office or with their friends, give them time to get with even if they have a baby, they need time away. Somebody needs to take that baby and give that mother a chance to have some time by themselves. Encourage getting out. Encourage doing the things that you still enjoy doing. Just because you become a mother doesn't mean that the whole world is over.
You're no longer a person.
Yeah, and the time that these little babies are small in the scheme of life, it's a very short period of time. But for that mother, when it's every single moment, every waking hour, it seems like the world is falling in. So I say that, what are some of the signs? Well, when they stop taking care of themselves. I've noticed that with women. They no longer are fixing themselves up or, putting on makeup or, they just let themselves go. Those are some of the signs. They're sleeping all the time. They're crying. Depression is real. And when you have a brand new baby that is completely and totally dependent upon you, it is a lot. And then it compounds itself when there is already a baby in the house, and then you have two of them.
Right.
It is really X to the second power. It's not 2X when there are two kids in the house.
I just really want to piggyback on that. I think I agree with both of my colleagues here, because there is this perspective. I often see this with patients where they think depression looks one way. They really think it's just a sadness, and it can manifest, like she said, anger. There are so many things, performance, hypersomnolence, wanting to sleep all day, so many matters. So, but if you don't feel right, if you don't feel right, just talk to someone. And I think we have to acknowledge now the suicide hotline, call 988. There are resources. There are people who are ashamed. I have women who are ashamed to tell their husband or their spouse. And then everybody doesn't have family and support. And so this is where community comes in.
Yeah.
There are some women who don't have support with family that they can get away or give the baby to. But there are circles, there are support groups. Hospitals are required to give you information. Take that information and use it. And we all can be better stewards of disseminating and making sure we're sharing resources with women who we may think need them.
Thank you. Thank you. Thank you so much. Oh, my panelists, I could continue this conversation. This has been really wonderful and dynamic. And, as we end on mental health, what I think about is conversation. It's talking. It's opening up. And so I think that goes for all Black women's health and wellness. We have to be able to acknowledge to ourselves and to others. And it does mean that there have to be safe spaces. And so I am honored that this was a safe space today. And I hope that we continue this conversation, and that anyone who's listening and anyone that has joined us this evening, that you continue this conversation amongst your girlfriends, amongst your colleagues. Go to your doctor, reach out, call someone. There are anonymous ways that you can actually talk to people. But we have to keep this conversation going. We must. And I might, don't be surprised if I don't call you and invite you out again, because there's just so much more for us to unpack. I want to thank you for joining us today. I want to thank my the Eastern Area team for all that they did to make this conversation and to make this night what I think has been a tremendous success. Please make sure that you're walking away with the idea of we all are empowered. We must vote. We must make our initiatives known, what is important to us and what is important in our community. I believe one of the reasons that we have better health when we have a doctor that looks like us is because it's a doctor that can relate to us. It's a doctor who understands our community. And so if you don't have a doctor that looks like you, then you have to advocate for yourself. You have to make your doctor understand that you are hurt, that you don't feel well, that you need to keep going, that you need more help, that this isn't working. Whatever this is, it isn't working. So again, thank you so much for joining us. And if you want more information, please follow the Eastern Area of the Links Incorporated on all of our social platforms. We will have more conversations. This was just the second of a series that we're doing. And I want to thank everyone for joining us this evening. And I hope that you feel elevated, and I hope that you feel empowered to move forward and advocate for yourself, your sister, and community, because we all need each other. We can't do it alone. Thank you again for joining us this evening. Good night.